Global health governance. Oh my goodness, that's a mouthful. Where are we going with this? Pay attention, I'm going to teach you something. I have a global health course that I teach at the university here in China. And I asked my students as I walked around the room, week number 3, and I asked them, can you tell me the name of our course? And some of them paused because obviously English is their second language. And then they began to say global health, global health, global health. So I said, well, most of you are 20 years of age and younger. You've never lived in another country. So it's hard for you to conceptualize what global health means. And I asked them some questions as to should the government decide your health and their policies and procedures and behaviors that they require of humanity, whether it be vaccination or specific healthy behaviors, or should that be mandatory, or rather not mandatory, involuntary, where kids and adults and people in the community can make their own decisions and decide and choose. And there were some various answers throughout the week, and they've been very wise and prudent and understanding and discerning as how they answered that question. But I was a bit concerned that maybe they didn't understand that government and governance can vary from a local, a regional, a state, and a national, and a global level. And I've experienced that because I've traveled to 90 nations, and I've lived in Africa, Asia, Latin America, Europe, and different parts of the world. And I've been able to experience the differences of governance. Even in my own country, as a licensed teacher in Florida and California, I've seen different approaches to dealing with the pandemic and wearing a mask or being locked down and not requiring that, and civil liberties being upheld and more freedom and autonomy for humanity in one state of Florida, and then less in California, more restrictions, guidelines, and protocols to adhere to. I'm not saying one's better than the other, but I'm saying they're different. And when understanding and teaching global health, I have to break that down to my students, because they could have a leader in China who's been in power maybe for 20 or 30 years, whereas in the United States, our president have term limits, and they are limited to no more than 8 years. So we've had President Trump, we've had President Biden, then Trump again, then we had Obama, then we had President Bush, and then we had President Clinton. So over the years, when you're flipping and flopping, twisting and turning and bouncing from one president to the next, one being Republican, one being Democrat, those policies can vastly differ, as can their initiatives, as can their governance, or the lack thereof. When President Trump became president in his first of 2 terms, the first thing he did is deregulate the economy, and in so doing, simultaneously deregulate the Environmental Protection Agency, the United States Department of Agriculture, and the Food and Drug Administration. So when you deregulate the FDA, the USDA, and the EPA, you are opening up the environment to harm, as well as the food supply and the health systems and humanity totally at a more larger scale, because those protections have been removed. Companies and polluters and businesses and industries are more at liberty to pursue economic profitability and disregard the health of humanity and the environment in which we live together and share, whether it be the air, the water, and the natural resources. So I had to teach my students the importance of discerning the policies and the approach and the values and the priorities of a given politician in different countries when they're evaluating a national policy pertaining to health versus global health, because every nation has different approaches and priorities based on who's leading that country. So I had to break it down and simplify it and help us all remember that there's not just one person presiding over the global health system, nor the global economy, that sometimes we collide, sometimes we have disagreements and differences, and rightfully so. Even mayors in states, as I experienced during the pandemic, from Los Angeles to San Francisco to Orange County, those policies were vastly different. There was a lot more freedom to not wear a mask and to not lock down in Orange County, California, compared to Los Angeles and San Francisco during the COVID pandemic. So be wise, beware, and be discerning, because leadership comes with discernment and decisions that impact us all. So you have to guard your health, guard your heart, be alert, and be attuned and in touch with what's going on, and how different states and cities and regions can impact health policy, and ultimately we the people and the health of humanity.